everyone! If you can hear me and see me and all is clear, if you could let me know, that would be awesome. Awesome. Okay, I'm getting some hearts, so I guess you can see me and hear me. I'm going to go ahead and introduce myself and give everyone a moment to hop on. I'm Jeannie Jenkins. I am a certified childbirth educator and birth doula through BEST. And tonight we're going to be talking about episiotomies, the risks, the benefits, and how we can prevent them. So I'll give everyone another second to hop on before I get started. Hey Kathy, hey Megan. Awesome, let me turn my volume up too, let's see. Did that help? My volume was all the way down. Awesome. Okay, so I'm going to go ahead and get started because I'm sure a lot of viewers will be replay viewers. So I'm going to start with what is an episiotomy. If you don't know what an episiotomy is, it's a surgical incision that is performed to enlarge the birth outlet to facilitate the delivery of the fetus. So in short, your provider will cut you to prevent you from tearing naturally. Episiotomies are measured in degrees. The most common is a second degree, and it's right midway between the vagina and the anus. A first degree involves just the layer of skin. A second degree is going to involve your skin and muscle. A third degree involves skin, muscle, and rectal sphincter. And a fourth degree will involve your skin, muscles, rectal sphincter, and the anal wall. So, now that we know what they are they recommended as a safe routine procedure? Well, the International Childbirth Education Association agrees with the World Health Organization as well as many other major medical organizations that the routine performance of episiotomies is actually not an evidence-based practice. It does not decrease perineal damage, and it actually can lead to more adverse reactions. So, in the past, it was one of the most common obstetric procedures that was performed, but if you know anything about the history of birthing and how the medical model has changed birth, it went from being a physiologic process to a more pathologic one, and so it was just another intervention on the list of interventions. That said, routine use has fallen more out of practice because more evidence of increased complications has arose. So, experts have affirmed that in today's time, the most influential factor in whether a birthing person will receive an episiotomy is not the characteristics of the birthing person or the wishes of the birthing person. It is based solely on the characteristics and the beliefs of the person's medical provider. So, unfortunately, because of that, there are still a lot of medical providers and birthing locations in general that do perform a lot of episiotomies. Women who are properly informed with the evidence of the risks and benefits are shown to barely ever consent to this intervention. So again, it is the routine or liberal use of it is due to your provider, and we do unfortunately see this in our area, as Kathy shared yesterday, the episiotomy rates for local places of birth. So, the reasons that they used to promote it is reduction of trauma to the fetal head, ease of repair and improved wound healing, and prevention of shoulder dystocia. All that said, research has shown that there's no benefit for any of those reasons that I just said. So, additionally, the episiotomy puts the birthing person at risk for an extension of the incision, which can lead to a third and fourth degree tear, risk of unsatisfactory anatomic results like a skin tag, asymmetry, fistulas, just improper healing, increased blood loss, higher rates of infection, and increased risk of a severe perineal laceration in your future deliveries. So I wanted to show you guys this paper example. A pelvic floor therapist that I love showed this example. So if you take a piece of paper or a piece of cloth or your perineum, if you pull this pressure, it's going to take a lot of pressure for this to tear and to tear more. But if you take a pair of scissors and you cut it, it takes no pressure at all to continue that tear, and as that first adverse event was extension of the incision, your second degree episiotomy could end up as a fourth degree tear because it has set the stage for a deeper extension of the incision. So that said, there are a couple times when an episiotomy may be worth considering with verbal consent from the birthing person. I am huge, if you know me personally or you follow me on anything, informed consent, I am huge on it. There's never a time when an episiotomy should be performed without consent from the birthing person. But if these things arise, it is worth considering with consent from the birthing person. If the baby is close to birth and there is true fetal distress and speeding up the birth process is necessary, it is worth considering. If there is cord compression during pushing, again, you need a quick birth at that point, and it is worth considering. Natural tears occurring at the top of the vagina near the urethra, it's not a very good spot to tear. Again, that's a point when it is worth considering. And if the birthing person has had an epidural and is unable to push effectively and is going to require an assisted birth from a vacuum or forceps, the provider is most likely, hopefully, going to get your verbal consent and give you an episiotomy. All of that said, there are ways you can prevent an episiotomy. If you are having a natural birth like at home in a tub, chances are you're not going to get one. That's not going to happen. But if you are in a hospital, there are some things that you can do to prevent it. The most important thing you can do, as Kathy said, it is so important who your care provider is. The most important, number one thing you can do is choose a care provider who does not perform routine episiotomies. And you also, that's not enough. You also want to confirm with your care provider that they seek verbal consent from their patient the moment that they believe an episiotomy may be necessary. That, it needs to be crystal clear. There needs to be no confusion there. Your provider has to not perform routine ones and get your verbal consent before performing one, even if he feels like it's an emergency. So, you also want to make it crystal clear to your birth team that you do not consent to one. Have your support person. We all know you want someone to help advocate for you. You want them to be aware of your wishes and prepared to advocate for you. And also, unfortunately, you want them to keep their eye out for the scissors because sometimes it really does just happen. Another thing you can do is make informed decisions about medicinal pain relief. I was talking about one of the times when you may need an episiotomy is if you are unable to feel that you're pushing. If the birthing person has an epidural, they really can't feel, you're not feeling those surges, your pushing is coached, so you won't be able to be pushing effectively, and in that case, your provider may feel like it is necessary to perform an episiotomy. Another thing you can do is try to facilitate optimal fetal positioning. So that's occiput anterior position. And so what that means is the baby is head down facing mama's spine, and their back is going to be to one side of the front of mama's tummy. So being upright, staying mobile, using a rebozo, there are a lot of different ways that you can help facilitate space for the baby to move into that optimal fetal positioning, which again is going to make it easier to push, easier for your body to stretch naturally, and your provider will be less inclined to perform an episiotomy. Birthing in an upright position, another way to prevent it, kind of goes hand in hand with that first one. When you're on your back, you're losing gravity, and you're also putting more pressure on your pelvic floor. So that makes it hard you're not really helping your baby move down the birth canal. So that also slows down pushing, and it can make it even seem like the baby is struggling to fit. So if the baby seems to be struggling to fit, sorry if you can hear my child in the background, she's fighting bedtime. If the baby is seeming like they're struggling to fit, your provider, again, may feel like assisting is necessary, which could result in an episiotomy. And the last thing that you can do is perineal support. You can perform perineal massages even during like your last trimester. You can do them during, you can have someone do them for you during pushing. A warm compress can also help. That can help soften the tissues to facilitate stretching. And again, if your tissue is naturally stretching with no problems, nothing seems off, your provider is less likely to feel inclined to reach for those scissors and interfere with your birth. So I'm gonna look and see if anyone has any questions. It's kind of the gist of everything. I'll give you guys a second if anyone has a question about anything. I think I pretty much covered everything. It is one of those things that unfortunately in our area, like I said, you really want to have consent from the birthing person. That's the biggest thing here. Just inform yourself, inform your provider, have clear communication with your provider. Let your support team, whether it's your husband, your sister, whoever's in there supporting you, if you have a birth advocate, whoever that is, let them know that you do not consent to one. Let your whole team of nurses and your provider know. If your provider is not the one who shows up, let that on-call person know. I don't want an episiotomy. I do not consent to one. Ooh, the difference. Okay, so the difference of healing with or without an episiotomy. I personally was given an episiotomy without my knowledge or consent at my birth, my only birth that I've had so far. Healing was very, very, very tough. It was very painful. I did tear even further because of the episiotomy. It was very rough. It took me weeks before I could even use the restroom without like crying. And a peri bottle did not help. Like sitting in the bathtub, a sitz bath while I tried to urinate did not help. I have heard, and studies show, that tearing naturally actually is a much gentler healing process, and with most women, when you tear naturally, it is more likely that you just will have you'll have some discomfort the first few days, a week or so, but you will be back to normal, and it won't be nearly as painful as your episiotomy that allowed for a 4th degree tear, if that happened to you. Hey Jennifer. Okay, so I think that is everything. I'll give one more second. And alright, well, I'm going to close this up. If anyone has any questions, you can still drop them in the comments and I will answer them to you guys. Hi Lauren, hey Caitlin. And I will leave this up for replay so that anyone can reference this. Y'all have a great night.